Hi guys. Thanks for coming. Thanks for letting me interview you. I really appreciate it. Do I have permission to record you, just to make sure that's okay with both of you?
Yes,
Yes, that's fine.
And we are going to. They've also agreed that we can record them, but they want to review anything before we publish it to make sure that they're comfortable with what's being said. Just conveying that to whoever actually transcribes this. So I'm Faye Evans. I'm the council member of the Global Council at Lifebox. And if the two of you could introduce yourselves and maybe just say a brief blurb about how we know each other, that would be fantastic. Tsitsi, why don't you go first?
Okay, I'm Tsitsi, Chimhundu from Zimbabwe, pediatric anesthetist, and I'm working in Harare, Zimbabwe at Harare Children's Hospital. And I've known Faye for a while. We met during the Pediatric Anesthesia Fellowship in Nairobi, and then when I came as an SPA fellow, and I mean, we've been collaborating since and become good friends.
Yeah. Yep. And Danai, I'm afraid of what you're going to say, but go for it.
Right. Hello, I'm Danai Marange. I'm a pediatric anesthetist working at Harare Children's Hospital in Zimbabwe. I've known Faye for a couple of months now, and through Tsitsi. So, yeah, that's it.
No, that's perfect. And where are you guys currently in Zimbabwe located?
In Harare.
Okay. And are there currently any COVID-19 cases in Harare?
Yes, they are. Currently, we've got 6 cases that have been proven to be COVID positive. One has since died, so that makes it a total of 7 cases.
Well, and is this in all of Zimbabwe or just in Harare?
All of Zimbabwe.
Okay.
It's in
and do you think this number is accurate? Because is there currently testing available or not?
There's testing available, but I think the numbers are probably not accurate because there's a lot of people in the community with symptoms, but we're not sure whether they're being all tested or if the testing is keeping up to scratch with all the probable cases. I'm not sure what Danai thinks, but I don't think it's accurate.
How do they think that the newscaster who passed away, how do they think he contracted it? Where had he been?
He was in New York. He was in New York.
Ah, got it. And did he come back to, did he die in Zimbabwe?
Yeah.
So he came back to Zimbabwe.
Mm-hmm.
Did he know he was sick when he came back?
Well, the story goes when he came back, he didn't know he was sick. He had a little bit of fever when he arrived at the airport, but I think for some reason he just slipped through the cracks. And then some days later, he started developing symptoms, went to see a doctor, and he was supposed to get into self-quarantine, but he continued to be up and about. And because of that, he had no contacts.
So tell me a little bit about the hospital where the two of you work. What is it? Is it an adult, a pediatric hospital, just adults? How big is it?
Okay, so it's a pediatric hospital, but it's not really a standalone hospital in the sense that it's part of Harare Central Hospital, which also has got an adult wing and maternity wing as well as the children's hospital. In terms of bed capacity, I think Tsitsi, you know better about the children's hospital.
The adult hospital is about 1,000 beds, and the children's, if I'm not mistaken, it was 300 or 400 the last time, about 400.
Okay, and do you guys? So are there any COVID positive patients in the hospital currently?
No, not confirmed ones.
Okay. And then what do you think, what's been going on in Zimbabwe at the country level, also at your hospital to prepare for COVID? Or anything is what is going on? Well,
Danai has been heavily involved with it. I think I'll leave her to answer that particular one.
So So what has been happening at country level, there have been a number of committees that have been formed. And most of these committees were only formed after the death of the newscaster. Prior to that, the major center that was being prepared for COVID patients is Wilkins Infectious Disease Hospital. If I'm not mistaken, the bed capacity that had been allocated for COVID patients is 40 plus something. It didn't have any ICU facilities, and they are still being under renovation as we speak. So at the time we had the one death, we didn't have any ICU facilities at this center. That's with Wilkins. So after that, a number of committees have been formed, but as of now, there hasn't yet been any official public hospital that has been allocated to do with COVID patients. So as we speak right now, the only place that patients can go to at the moment is Wilkins Infectious Disease Hospital. Although discussions are underway to see if we can at least convert one of the public hospitals into a COVID center. And there's also some talk that is going on. I can't say 100% confirmed to also have private institutions that will be managing COVID patients.
So currently, like for an example, if a patient who is COVID positive came to your hospital, they wouldn't be able to be admitted if they knew that they were COVID positive.
No,
No,
they're not.
they won't be.
What I would actually add is that at Wilkins Infectious Disease Hospital, they don't have any intensivist who's working with them or ICU nurses. So if there was an actual patient who needed critical care in terms of personnel and also the equipment, there are no dedicated people who are there.
Do they have, and they don't have ventilators, or they do have ventilators?
No, they don't have.
As of today, they have a few ventilators that have now arrived, but
Okay.
They are still to be set up in the allocated spaces for the ventilators are still under renovation.
How widespread is the availability of like oxygen concentrators? Are those widely available?
No, they are not. And as for Wilkins, it actually didn't have any piped oxygen, and they were relying on cylinders, and they were kind of running out with the last patient who was admitted there. So oxygen is an issue. Availability is also an issue at the moment.
Do they have the ability, like with monitoring, to be able to measure saturations, like with Lifebox pulse oximeters and things like that, or no?
I won't be able to answer that positively. What I know is that when the patient who deceased was at Wilkins Hospital, they were measuring pulse, the saturations. What I'm not sure whether it was a Lifebox or it was
Something else, right?
else, yeah.
What is the government at a government level? Are they doing anything at all to prepare the public to try to prevent the pandemic from spreading in Zimbabwe, such as social distancing, shutting down businesses, anything at all?
What has been,
You're muted. Tsitsi, you're muted.
can you hear me?
Yeah, now we can. Yeah.
Okay. So I was saying there has been a lot of public information going out in terms of social distancing and avoiding crowds. So initially when the outbreak started, they started saying you can't have gatherings of more than 100. And as we had more cases, they reduced it down to 50. And as of today, we're officially in a lockdown. And only people who are involved in essential services, such as us as doctors, and those in the maybe food services and grocery stores are allowed to move around. And the police and soldiers are actually on the roads, manning the roads, making sure people are not moving around. So we're in a sort of like a lockdown for 21 days. And they're hoping that will somehow curb the spread of the disease. The borders have been also shut down. I think those are the major things, mainly the main principles of a lockdown.
Okay. So many people out there often think of folks who provide anesthesia as the doctors or the non-physician providers who put patients to sleep for surgery. but we know in your setting, your responsibilities can go much broader than that. Danai, it looks like Tsitsi might have frozen again. Can you share with folks what other roles you play other than just in the operating theater and putting patients to sleep? Do you have any roles in critical care or other things?
Okay, so in our setup, we actually don't have any intensivists. So besides having to provide anesthesia, we also have to manage all patients who require high care and who require intensive care support. So
Okay.
yeah, those are major roles. We also double up as intensivists.
So as an anesthesiologist, and especially in your setting, what are your concerns right now regarding COVID? You know, do you feel like you're at risk, and why?
Sorry, come again?
So do you feel like as an anesthesiologist in your setting that you are at risk for COVID, being exposed?
Oh yeah, that's a major concern.
Yes.
It's a big fear. And I think what's happened in the last week or so is even our registrars who work in the department have had so much fear that they're missing days at work, they're calling in sick, because I think our exposure is much higher. And if it comes to the fact that if patients need to be admitted in ICU and we need to take care of them, we are not many anesthetists in the country. We feel like we'll be overwhelmed. We'll be on the front line. We're at risk. And even if I'm to get sick, I'm not sure whether the system will be able to give me the support that I need.
Right. Do you
That's the worry. I'm not sure what Danai was.
Deny anything to add to that?
Yeah, the other issues that have been affecting us is that people are worried about their families as well. For most people, they don't stay in big houses whereby you can self-isolate yourself when you come back from work. So that has been a major concern. And also because there is inadequate testing. So even in our interactions in the hospital right now, we say we don't have patients who are COVID positive, but the reality is we don't know. And also as things are, even for us, the health workers, the other fear is, so if I get infected, what happens to me? The isolation center is not yet really ready. So if I get sick, what happens?
Well, yeah, and if you're not testing, it's kind of hard to know who goes to the isolation center. You can easily see how and you could be exposed and not even realize it at your setting. It sounds like you guys, just from a practical standpoint in the ORs and your setting at your hospital, it sounds like you do not have PPE, correct? Personal protective equipment. Do you have N95 masks? Or any type of mask that you can wear to protect yourself from COVID?
Well, the N95 masks are not in every single hospital because in our setting, you have to work in the two major hospitals in Harare, which is Harare Hospital and Paranyato Hospital. And I only think the masks became available around about Friday and Monday, if I'm not mistaken. But all along, they were not widely available. And in addition, we also have to go into the private institutions. And there, it brings in another facet where there's not enough PPE. So I think our exposure is greater because we hop from institution to institution.
And have the surgeons reduced their elective cases because of all
that?
Yeah. Okay, so that's good. And then what, so question I asked recently, because you guys in our ORs, we have the ability, the air circulates. So they, you know, if during an intubation, if the patient, they was to aerosolize some of the virus, there's a filtration system in our operating rooms where they're doing a constant exchange of air. So within 30 minutes, there would be no air, there would be no virus in the air because of the circulation. I know that does not happen there. Do you guys have negative pressure rooms, or do they exist in your setting? No, I didn't think so. So the other question is, when you hook a patient to a ventilator, Do you always put on a viral filter? Do you know what I'm talking about?
Yeah, we do, but not always. It
Okay.
depends on whether they're there. Would you agree, Danai? Because sometimes they're not there.
So you don't have those, are not readily available.
They are there, but I wouldn't say they're there every single time. What do you think, Danai? Maybe she's frozen.
Let's see. Is she back? I don't see her.
Yeah, I don't see
She
her as well.
dropped off. She'll come back.
Okay.
So the filters, because the filters do protect what we were all of a sudden discussing is, let's say you anesthetized a patient who is COVID positive, okay?
Mhm.
And let's say they were breathing out.
Back.
What? She's not
I
back
think
yet.
she's back. Not yet. Okay.
Not yet. And let's say they exhaled and you did not have a filter in place. The virus could get into the machine.
Exactly.
And then the fact that you don't have a scavenging system, do you?
Yeah, that's the other issue. We were trying to do a simulation a couple of days ago, like last week. Now that there's the whole COVID thing, we've been emphasizing to have a filter every single time
Okay,
that
great.
we're intubating any patient because we're treating them as positive. We don't know.
Perfect. And
But
no,
we don't have scavenging systems.
great. So as long as I think you just need to change that filter every single case, it's super important.
Mhm.
What about
Mhm.
the other place that you have to be really careful about, Tsitsi, is the end-tidal CO2 sampling? Do you have end-tidal CO2 or no?
I would say in most of the theaters, there are some that don't have end-tidal.
So you just need to make sure that that end-tidal CO2 sample is after the filter. Or the other thing you can do is take a stopcock and cut up some of the filter, put it in the stopcock so that that gas, that sample line gas that gets through it gets filtered as well.
Okay.
Make sense?
Yeah, we generally put it after the filter.
Okay, good. So then that should be fine.
Mhm.
What would you say, and hopefully Danai comes back, but if she doesn't, what would you say as far as what do you need mostly right now for your hospital and your system? What do you think?
Okay,
Yeah.
so what we need right now, first of all, we need to start with a definite protocol on how to handle a COVID patient in terms of if they need critical care, if they're coming to the OR, or even if they're to present at hospital, how do we handle them? Because right now we don't have a clear protocol of how to handle such a patient. Number two, we need training on how to use, like the donning and the doffing of PPE. Even if the PPE is available, we have not had any formal training on how to put on and put off the PPE. I think that's the major big thing that we need to start with before we even wait for any equipment. And then we need the actual PPE. Right now, what I can say is, yes, we've canceled a lot of elective cases, but even for the emergency cases, people are looking for any excuse not to go to work because there's a fear of exposure. There's not enough PPE. So if that was to become available, that would help. The N95 mask, like I was saying, not readily available. And also equipment to use in terms of ventilators, in terms of critical care, consumables and resources and so on. Then I would say lastly is we need a clear pathway in terms of which hospital would be designated as a COVID hospital. Obviously, we can't have COVID patients at every single hospital. So in Harare, for example, we have 2 major government hospitals, and we were asking them, because there are not enough anesthetists and intensivists to go to the infectious disease hospital, can they convert one of those hospitals to become a COVID center so that we avoid contamination between the 2 centers, and it's clear we get ready, because right now we feel like we're just waiting for the bomb to drop. We're not ready at all. So those are the things that I think we would need to start with, because right now we feel very exposed.
Do you think some of those protocols will be developed in country, or would that be something that the global community could try to help you with? I know the PPEs, you'll need help from the global community for sure.
Yeah, well, having a framework to work with from the global community would be excellent. But some of the, the nitty-gritties would need to be sorted out at country level because we've got different problems.
Right.
And probably the mistake we made is we thought that it would come from above to us, but we've realized we just need to start working on a protocol as a department, and we've been working on that and doing some drills on how to protect ourselves, because clearly the protection might not come from up there. We need to be proactive and get it going.
Lifebox, Nicole is starting to put together, Nicole Starr, a whole document about the do's and don'ts of PPE, which I think will be invaluable, specifically geared towards an LMIC setting, not our setting. And to be honest, guys, we're facing very similar issues in that we don't have enough equipment. We're panicked. We don't have the protocols. They're definitely going into place, but they're not black and white. I mean, it seems like things are changing daily. So it's not like we have all the answers. We're learning, and I think folks are just genuinely interested in sharing all that they can. The one issue I will tell you to think about as the government in practice, in practicality, the idea of having one hospital to care for these patients is going to be challenging because you don't always know that they're positive. So while you can try to minimize the amount of COVID positive patients that are in other facilities, you need to remember that children, for example, get exposed and you don't even know they're positive because their symptoms can be quite mild, but yet they could be shedding virus. So I think it's an interesting idea to limit and try to isolate like that, but in practicality, it's not going to be quite like that.
So do you think we should just, let's say we've got COVID patients in each hospital, we have like a wing for them?
Yeah,
or
I don't know, because the problem is you don't always, I mean, you just got to make sure that patients who come in who have symptoms, obviously, you know who those are and separate them, but recognize that they're going to be patients who are asymptomatic. Especially children, which affects us so much. And I think that's what's given the angst to us in our hospital is that we probably won't see a ton of really sick patients, but we're going to be exposed as healthcare workers because they're going to come in and, you know, they're going to be positive. We're not going to know they're positive, and then we're going to get sick, and then we're going to go home and spread it to people. See what I mean? So I think that's another concern that we have. I'm curious. So Danai kind of told me this as you were off but I'd be curious to hear, as you face this outbreak in your country, what do you fear most?
Well, on my part,
I fear also infecting my family.
Yeah. Danai said the same thing. What gives you the most hope as we go forward and kind of the unknown? We all are in a period of unknown.
I think the fact that at least in children it's mild, so at least my kids will probably be fine.
Danai, do you have anything different?
I mean, for me, when I just look at what this thing has done in the first world countries where we are better resourced and with the PPEs and everything, my hope is, because I know that as people we are doing, and as the medical profession, we are doing as much as we can, but at the end of the day, doctors have been infected even with full protection. So yeah, my hope is in God to protect me.
Yeah, you know, it's amazing to hear from you guys because you're the best of the best in your country, right? You're educated and you're in the most well-resourced setting. And then I think about the non-physician providers out at the district hospital, and I don't even know where to start for them. I mean, it's kind of, if the patients really get out there, it could really devastate things quite badly. But I don't even know how you prevent that. Because it's not like Ebola where it's a small area you can isolate. It's everywhere.
Yes. Yeah.
It is, yeah.
It's everywhere.
All right, I'm going to stop the recording now. Hold on.